So how we are going to diagnose these cancers? So until now, there's so much of research evidences and also so much of technology. So there is no single test to diagnose the cancer test. So how to do so many different type of tests and also to evaluate the patients completely and thoroughly through the physical examination and also investigation procedures and also diagnostic tests and as also clinical according to the clinical features. So we have to thorough and also have thorough to assess and also thoroughly, as well as we have to see the diagnostic procedures, physical examinations. Then only we can give the final conclusions according to the all these diagnostic procedures, the process. So here many tests are needed to determine whether the person has the cancer or is the another conditions. So such as mimicking like a cancer, which are the like infections or maybe other related symptoms. So that's the reasons we have to check the blood like a analysis in the blood and also urine and also bio like a blood like a tumor markers, imaging technology, how to use all the techniques to and also to evaluate and also to give the final diagnosis. And also effective diagnosis testing is used to confirm or eliminate the presence of the disease. We are going to eliminate the disease as well as we are going to monitor the disease process and plan for the evaluate the effectiveness of the treatment. So that is the important. This diagnostics is going to be not only diagnose the conditions and also it also going to is eliminate the disease if we diagnose early, and also we are going to monitor the disease process, how the disease is going to develop, and also you will evaluate the effectiveness of the treatment, how is responding to the treatment and also therapy. So we can use the diagnostic procedures. In some cases, it is necessary to repeat the testing when the person's condition is changed. If a simple collected was not good quality, and abnormal test results need to be confirmed. So here is going to be, that's the reasons we have to like repeat the test, how the improvement sometimes is not going to give the clear informations, or sometimes is going to be alter the response, maybe the fluctuate. So we have to do these tests and also record it. So then only we can check how is the progression is there, how is the improvement is there with the medications and also disease progress and also the prognosis. So many different tests we have to do to rule out the causative factors as well as what type of the cancers. For this diagnosis, so many tests are there. So these procedures including the imaging technology, so such as the X-ray, CT scan, and also MRI scan, and also laboratory tests, including the test of the tumor markers, and also the tumor biopsy, so endoscopic examinations, some surgeries, and genetic testing. So these are all going to give the clues about the tumor and also give the information about what type of the tumors. So these diagnoses are including so many types. So these are the lab tests, diagnostic imagings, endoscopic examinations, genetic tests, and also tumor biopsies. So these are the different types of the investigation procedures and diagnostic procedures for the assessment of the tumors. So if you see the lab tests, so these lab tests are in the many lab tests. So these are going to give uses the chemical process to measure the level of the chemical components in the body fluids and also tissues, especially in these common specimens used in the clinical chemistry is the blood and also urine. So whatever the toxins, so whatever the abnormalities we are going to, if any develop in the abnormalities in our body, in the fluids, so we commonly check, we can find in the urine and also blood, we are going to find the different like toxins and also related to the cancerous materials we are going to find. So if you do the urine analysis and blood analysis, is easily found the abnormal cell development and also growth. So and also components may including the blood glucose, electrolytes, enzymes, hormones, lipids, other metabolic substance and proteins. So these are also we have to check in case of the lab test. So these are going to give the clues to identify what type of the cancer and also which type of the structure is involved. So according to this, according to these reports, so we are going to identify. So these lab reports are especially the blood test and also complete blood picture, blood count, and also urine analysis and tumor markers. So if you want to know the exact cancers, so we have to do so many tumor factors, tumor markers to evaluate what type of the tumors. And also especially for the blood test. So what blood tests are going to give the complete information about the cancers. So these blood tests are going to give is the clear information about the cell count, measurement of the various blood chemistries, and also markers, and also of the inflammations. So these are going to identify in the blood test. Especially, so when we measure the many things in the blood, such as the salts, blood cell count, proteins markers, specific to the hearts. So we are going to check all these things in the blood test. So additional tests may including the blood chemistries and also evaluation of the liver, kidney functions, and also genetic studies. If this you are having the kidney abnormalities or liver abnormalities or genetic abnormalities, also we are going to find in this blood test. And also in case of some genetic disorders or in the genetic testing also, maybe we can recommend some blood test. So that is the importance of the blood test. So during the investigation procedures. And also coming to the next to the blood test, so this complete blood count. So this is the very, very important if you want to know the type of the illness, is it the cancer or infection or inflammations. So what are the causative factors for the illness? So we can analyze easily with the blood count. So these are going to be the complete blood count. So measure the size, number, and maturity of the different blood cells in a specific blood values. So this is the most common type of the test who have got the illness. So with according to these reports, the size and shape and also volume of the blood cells. So we are going to differentially diagnose the causative factors and also type of disease. For example, the red blood cells are important for the carrying the oxygen and also fighting anemia and also fatigue. So if, for example, these red blood cells are going to be important to know our health status. The hemoglobin portion of the RBC or the CBC measure the oxygen capacity and also of the red blood cells, while hematocrit measures percentage of the red blood cells in the blood. So that is the reasons if you want to know the level of the health status and also oxygen level in our blood also, if you know the hematocrit measurements, so we can know the blood cell health status. And also what about the white blood cells? So this also we have to know the white blood cell count. So we can know the white blood cells count. So depends upon the severity of the infections. So this may alter if anybody get any infections, or in case of anybody having any like tumors, also may chance to get the increasing the white blood cells. Or maybe it's maybe decreased in case of any rheumatic diseases or any other reaction to the medications. So we have to know in which condition the red blood cells are increased and which condition the white blood cells are going to be increased. So in case of red blood cell decrease means, so those people having the anemia, or maybe who are having the anemia, so they may chance to get the decreasing the blood circulations and also oxygen supplies to the tissues. So we can easily understand. Or same like in the who are having the high like a WBC count, white blood cell count. So it indicates in the infections, or maybe in case of who are having some immunity disorders also. So may chance to get the high is the infection, that means is the blood high blood white blood cell count. But in case of decreasing these cells, maybe is because of the rheumatic disorder, or in case of the any medical like any medication reactions. And also next one is a platelet also have to check. So these platelets prevent the body from the bleeding and also brewing easily. So this is also usually performed to check for the blood infections. So who are having any blood infections. So if we check the platelet count also, so we can get some clues about the blood infections or maybe blood cancers. So coming to the urine analysis. So these urine analysis are going to give the full information about the any cells, red blood cells or white blood cells, or maybe in case of any protein in the urine. So these are going to give some information about the urine analysis. So if you get all the information about the red blood cells, white blood cells, and also infections and also excessive protein. So these will give the clear information about who are having some problem with any kidney disease, any cardiovascular disease, or maybe who are having some diabetes. So in case of who are having the high level of the proteins, so it indicating the proteinuria, it indicates the kidney disease and also cardiovascular disease. Or maybe who are having any like a bleeding inside the urine, so it may indicating any infection, or in case of any tumor, or in case of the prostatic tumors or benign hyperplasia of the prostate. So these may use some clues regarding what type of conditions may chance to get with this urine analysis we can easily understand. So that is about the urine analysis.